Good morning, everybody, in a morning time zone. Afternoon to those of you where it's afternoon, and good evening to those of you where it's the evening. My name is John Balbus. I'm Senior Advisor for Public Health at the National Institute of Environmental Health Sciences, and I'd like to welcome you to today's webinar, our third in a series of 3 webinars this fall. This one is a very special one. The topic of today's webinar is making linkages between sustainable development, equity, and social justice. And our series of webinars is held under the coordination of the Institute of Medicine Roundtable on Environmental Health Sciences, Research, and Medicine. Our webinar series is also supported by the National Institute of Environmental Health Sciences and the Pan American Health Organization. I want to acknowledge, as we get going, the planning committee for the series of webinars and for today's webinar, which did a wonderful job putting this together. These include Dr. Guta Galvao of the Pan American Health Organization, Dr. Bernie Goldstein of the University of Pittsburgh, our roundtable chair, Frank Loy, Kumanan Rajanathan from UNICEF, Lucilla Spini from UNEP, the United Nations Environment Program, and Judy Wasserheit from the University of Washington. Today's webinar, as I said, is the third in a series of 3. Our first webinar was devoted to looking back at the Millennium Development Goal process for lessons learned in how health was integrated into development issues, as our whole series of 3 webinars is devoted to that. But the first one was really looking at the UN process and what we had learned from the MDGs. Our second was looking at approaches to integrating efforts across sectors, recognizing that achieving environmental health in a context of sustainable development means bridging across the sectors, and environmental health is really a unique bridging discipline for that. Today's webinar is really a complementary webinar where we were talking about the bridges between sectors in the second webinar. Today is really about the bridges between the traditional pillars of sustainable development, which are environment, economic development, and social elements, and recognizing that achieving sustainable development and actually being able to reduce harmful exposures and do something about the health of those most exposed around the world requires confronting social issues of poverty, inequity, and social justice. We have 3 extremely capable and wonderful speakers today that I want to get to as soon as possible, but I just wanted to spend a couple of minutes looking at our word cloud. So as people register, they're asked what sustainable development means to them, and these, I think, provide an interesting context for the discussions that we'll have today. This is, those of you who are viewing the screen can see the word cloud from those registering today, and you can see that we have definitions and contexts that are a little different from where we were before, much more focused on issues of equity. We have end exploitation as a significant concept, looking at equity, looking at opportunity, and of course development. The last time we did this, the word cloud focused a little bit more on environmental issues, balance, preservation. So just an interesting glance into the audience that we have. So without further ado, let me introduce our first speaker. Our first speaker is Dr. Úrsula Oswald Spring, and we're very fortunate to have Dr. Oswald Spring. She's a professor and researcher at the National University of Mexico in the Regional Multidisciplinary Research Center. In 2009, she was elected as the National Coordinator of Water Research in Mexico to establish a network of water researchers, including scientists, government officials, and representatives of private enterprise. She was the first MRF chair on social vulnerability at the United National University Institute for Environment and Human Security in Mexico, and co-founded the Peasant University of the South in Mexico, where she still serves as an advisor on women's and environmental movements. So Dr. Oswald Spring, it's a pleasure to have you with us this morning, and I'll turn it over to you. For each of the speakers, we're going to allow about 12 minutes. If you hear some repetitive throat clearing coming in, that will be my signal that it's time to start wrapping up. But let's aim for 12 minutes, and we welcome Dr. Oswald Spring.
Thank you very much for this so kind introduction. Thanks a lot to have the opportunity to talk together all over the world. And obviously, environmental perspective is related with the gender issues and with the future. I think here we will have a problem because I wanted to start with global environmental change affecting health. So we have several processes which we can't see because they are all together. So we can't display them one by one, but I will insist. On one side we have the population here in this part. Then we have always the emission of greenhouse gases. This brought us to global temperature change. Finally, with the Green Revolution, we brought the anthropogenic nitrogen, which is going up and which is bringing us an enormous nitrogen flux also to the sea, and thus this creates a lot of loss of species, forestry, also the biodiversity on the sea, and finally species extinction. But I want on the other side introduce gender. Gender not only understood as masculinity and femininity, but understanding roles, norms, values, behavior, social representations, responsibilities, necessities, expectation, but also sexuality and sexual behavior. And on the other side, this process brings us in a division of labor, in power and responsibilities, and finally has a lot of impact on the distribution of resources and of benefits. Without any doubts, the ecosystem is bringing us most of our services. So on one side we get the provision side, food, water, air. On the other side we have the supporting services, where we have the production, the nutrient cycle, we have the sulfur cycle, we have the CO2 cycle, and so on. And finally we have also from nature the regulating services, the benefits obtained for the regulation of the ecosystem. And this is crucial in the climate change and the global environmental change discussion, because obviously with growing and increasing temperature, we will be happy to have these environmental services. But normally we are losing the cultural approach, where we have the full human well-being, to have security, you have material minimum, we have freedom from choice, freedom from want, and freedom from necessities, and we have obviously the social representations. We have worldwide, and you can see it compared this 30 years of difference, an increasing freshwater stress, but we have also high pollution, and still today more than 80% of all illnesses are related to polluted water. On the other side, we, the human being, the last 50 years have done an enormous change on our Earth. 20% of coral reefs were lost and 20 others degraded. 35% of the mangroves, which are the highest biodiverse parts on Earth, are getting lost. We have quadrupled the water in the reservoir since 1960s, and obviously the withdrawal from rivers and lakes has doubled since the same time. And most water is today, of the surface water, 70% used in agriculture. All these processes obviously has changed a lot our process. And here we have the costs. We have on the left side the fossil record of the extinction. Then you have in the green part now 1,000 times a higher extinction rate than we had it in the fossil part. And if we continue on this side, we will have 10 times more. That means, it is geographical scale, 10,000 times more extinction. Where will we get the environmental services to live in peace? And this brings us, obviously, that today we are using 1.5 Earth. And if we continue with this, we will use in 2050 2.5 Earth. We only have one. Don't forget it. Soil degradation is a process we normally don't speak about it, but it's the crucial sustain of all the environmental services, also for our food production. Then, speaking directly to the links with health, I just took the dengue vectors, which is worldwide one of the most dangerous processes due to climate change and global warming. Today, the population exposed to dengue is increasing from 35 to 60%, and the estimation in 2085 will be about 6 billion of people at risk. And just where I'm living, we have had last year a 600% of increase of dengue fever. This means that is one of the big threats now related to climate change, to global environmental change. But we were speaking about inequality. And here we can have on the left side the emissions of the greenhouse gases, and on the right side we have the health impact related to climate change. And you can see clearly Africa, which has almost no emissions, is the continent which most hard affected by climate change, but also India is an enormous problem for the moment. So we will have to do not only mitigation but also adaptation process to reduce this health impact in the people. And this brings me finally to a process. We have had the big meeting in Rio de Janeiro 20 years later. We have just had now in Doha the discussion about post-Kyoto Protocol. And here you can see the three mindsets we use normally. We have on the one side the oil companies, the big multinationals, absolutely promoting continuing with all the fossil oil system and very few renewable. You have a proposal from the Energy Information Agency, very similar. And finally, you have an alternative model. What we should achieve in order to maintain and to continue, not only for human beings, but also for nature to have a sustainable way to find a transition where we could really reduce our fossil emissions and where we could reduce the greenhouse gases. And this brings me to the vulnerability during disasters. You have these 30 years, you can see clearly more than 2 million deaths, more than 5 billion people affected. And the big problems, if you look at the affected side, is drought on one side and floods. If you look on the side of the dead people, you have also droughts, so we have to care. And about 1 billion of people are living now in semi-arid and arid regions, so they are highly exposed by climate change to this process. And therefore, their life is threatened. So, what should we do for the next generation? For the training of the health practitioners, we must have a transdisciplinary integrated approach where psychological, historical, public policy, communication processes are coming, and on the other side we need to think about population policy, we need to have public health, we need to care about the veterinary and medical because a lot of illnesses are coming, evolutionary and comparative, we need environmental and ecological process, but we need also the medical part, the biomedical part, and finally, very important, the governance issue. And this brings us to a new adaptation where we bring in, on one side, the gender issue, human adaptation, human capability, this would be the human capital, then the environmental capital, natural recycling, energy, ecological resources, and ecosystem processes. And then obviously we need to control also the medical part, the science part, human fertility, to create a sustainable human population with sustainable economic system and energy processes. And all this together must be linked with a different economic model of life. We can't continue to concentrate wealth in just 1,200 people who have only who own now, this 1,200 people own half of the wealth of Earth. We need to have a distributive effective way in order to advance perfectly in this way. And sorry, I want to go back. If I have some more minutes, this brings us to what we have proposed. Transition to sustainability. I think the developed approach, where we have the community of overcoming the poverty on one side, and where we have on the other side the disaster risk management, we have the science of climate change, these interlinks we have put together in the last IPCC special report called THREX on extreme events, where we precisely put these three epistemic communities together in order to find a way, in order to have a future for Earth and for human beings. And I think this is the big challenge we will have for the moment. And this signifies not only to change the mindset of the energy system, but we need also change a worldview. I think, and it's very interesting, I'm coming back from Myanmar, where I gave a course about disaster risk management and adaptation. And it's so interesting to see how the Buddhist approach, where we have no God who is controlling Earth, but where we have the human beings responsible, I think, to retake this approach of cultural beliefs in order to change our worldview, in order to transform our mindsets, in order to bring policies worldwide, national and local, in order to get through this sustainable transition, we need to work together. And this brings us to the last point, the gender issue. If we have a capitalist system of about 500 years, where we have this destruction of environment, but if we go back and find the root causes, we must come to a violent, exclusive, and obviously dominant system, which is called patriarchy. And if we could change this way and go to a more a process of greater equity, I think we can find a way in order to go to a new process. If not, the future will be very uncertain, will be very threatened, specifically for the socially most vulnerable. And who are the socially most vulnerable? Normally girls and women in the South. If you look at the disaster data, you can always see in any disaster between 68 to 70 up to 85% of the dead people are women and girls. So we need, when we do policy, specifically focus to these vulnerable groups, because women normally care about the rest on the cost of their own life. This is crucial for the survival of Earth, for the survival of human beings. What would we need to do is to really reinforce this process in order that women can do this support process we have within environment, within human society, but without getting threatened to lose their life. And these are crucial links where we must work: equity, poverty alleviation, sustainable transition together in order to find a way where we have human capital, where we have social capital, cultural capital, economic capital, political capital, where we go to a participative governments where everybody find a way to live in this future Earth, probably with 9 billion of human beings, with a lot of challenges in order to advance. Do I have still 1 minute, or my time is over?
I think that we will need to move on to other speakers, but that has been a wonderful introduction. Dr. Oswald Spring, you've raised some very high-level themes. I'm sorry. ranging from theology to economic systems to the political and to the need for interdisciplinary work. And I hope that as we get to the discussion, we can really dig into this a little bit and talk about operationalizing some of these concepts. But now I'd like to move on to our second speaker. And again, thank you very much for a wonderful start, Dr. Oswald Spring. Our second speaker is Dr. Michael Marmot. Dr. Marmot is Professor of Epidemiology and Public Health and the Director of the International Center for Health and Society at University College London, as well as an Adjunct Professor of Health and Social Behavior at the Harvard School of Public Health. His life work is focused on social inequalities and their impact on health. He has coordinated 2 European research networks and is now co-coordinator of the European Science Foundation Network of Inequalities in Healthy Life Expectancy. We're delighted to have Dr. Marmot joining us today, and I'll turn it over to him now. Thank you very much.
Thank you very much indeed. And my presentation will be complementary to what we just heard from Dr. Oswald Spring, because she talked about equity and poverty. I'm going to focus on equity and poverty for 2 reasons. One, people's degree of poverty and social disadvantage renders them more susceptible to environmental challenges, and they're more likely to be exposed to environmental challenges. But secondly, we need to get our policies on the physical, biological environment aligned with our policies on the social environment. Now, my approach to this comes from the 3 major reviews that I led on social determinants of health. The first, of course, was the WHO Commission on Social Determinants of Health, and our report was called Closing the Gap in a Generation. In the light of that, I was asked by the British government to look at health inequalities in England, and we called our review Fair Society, Healthy Lives, because it was a statement that if we put fairness at the heart of all policy making, health would improve and health inequalities would diminish. And the third is the review of social determinants of health and the health divide in the WHO European region. The executive summary was in the Lancet in September, and the full report will be published in the first part of 2013. And I want to give you just a few illustrations from our European review. This is the model that we've used for the European review. It's recognizable to those of you who are familiar with the CSDH, the Commission on Social Determinants of Health. We have life course stages. We look at the wider society, the micro-level context, which of course includes many of the things that we just heard about, and systems. Now, to show you examples of the fact that the magnitude of health inequity is not fixed. All societies have social hierarchies, but the degree of health inequity that follows from social and economic inequity is not the same in different countries. These are slope indexing inequalities by education. In other words, the smaller the slope index, Spain right at the top here, the less the differences in mortality by education. And you can see there's the European average. Slovenia, Czech Republic, Poland, Estonia, Lithuania, and Hungary, the countries of Central and Eastern Europe and the former Soviet Union, all have much bigger inequalities in mortality than the countries to the west, north and south. So the magnitude varies enormously. Our reviews were very much addressed to both the causes and what you can do about those causes. So let's start with prenatal and early years. This shows child poverty rates defined as less than 60% of median income before and after social transfers. So the light green shows child poverty rates before social transfers. Look near the bottom at Italy, for example, where before social transfers, poverty levels were about 33%, and Belgium, where they were the same. But after social transfers, poverty levels went down to about just under 25% in Italy, but in Belgium went down to about 16%. In Sweden, which was again fairly similar before transfers, the poverty levels go down to about 12%. In Norway, just over 10%, and in Iceland. In other words, government policy determines what the child poverty level is. Government policy may not do too much about child poverty before transfers, but can do an enormous amount about child poverty after transfers. Poverty, a key determinant of health, is affected by government's fiscal policy. Access to preschool by wealth in different countries of Central and Eastern Europe and the Commonwealth of Independent States of the former Soviet Union. You can see for the poorest quintile and for the richest quintile. In Bosnia and Herzegovina, very little access to preschool. In Belarus, high access. But in all of these countries, access varies very much by wealth quintile. Now we know that access to preschool, which is a key determinant of early child development and children's readiness for school, is a key determinant of outcome of education, which in turn is going to influence adult socioeconomic conditions, which in turn will influence inequities in health and adulthood. Early child development and education are drivers of unemployment. And again, unemployment in the eastern part of Europe among the total population, the pale green, and among the 18 to 24-year-olds. In Macedonia, we've got youth unemployment in excess of 50%. In Bosnia and Herzegovina, in Serbia, we know in Eastern Europe, in Western Europe, in Spain, the youth unemployment is in excess of 50%. Now this is, again, affected by government policy and by macro policy. And it matters. And it matters because what we've seen across Europe in the recent economic downturn is that a 1% rise in unemployment is associated with a 0.8% rise in suicide, a 0.8% rise in homicide. But you could say there's good news. Traffic deaths go down. People can't afford to take the car out. And we've been arguing to governments in Europe that if you are going to pursue policies of austerity, that predictably will increase unemployment. Your policies will be responsible for an increase in people killing themselves and killing each other. Government policy is crucial. Look at the situation of the older people. In the English longitudinal study of aging, people 50 and above, by income quintile, you can see that people in 2008, people in the poorest income quintile spent 48% of their income on basics. People in the richest income quintile spent 16%, and a graded relation. With the economic downturn, what we had seen was that the increase from 2004-05 to 2008-09 was 12.5 percentage points in the bottom and a decrease in the top. So the economic downturn made things very much harder for people at the bottom, and their ability simply to spend on basics was reduced. I'm arguing that government spending really makes a difference. This shows the relation between social welfare spending and all-cause mortality in 18 EU, European Union countries. The higher the social spending per capita, the lower the all-cause mortality. we argue that when governments say, in the face of economic problems, we're going to pursue policies of austerity, which will include reduction in spending on social welfare, once again, that will harm people lower down the social hierarchy and is likely to have an adverse impact on health. This is where I began. I said that we've got to put issues of health equity and sustainability together because they are both part of social justice. In my very brief touching on this issue, I try and make clear that the evidence shows that policy at the local level, at the national level, and at the international level has huge impact on the lives people are able to lead, and hence on health and health equity. Thank you.
Dr. Marmot, thank you very much for an excellent overview of social factors and social inequity in health, and again raising many issues, just kind of whetting our appetites, I think, for making these links between the evidence that you've shown and evidence on policies and social welfare programs and the physical environment, and how do we make those links, and how do we operationalize the concepts that we work on in the economic sphere and bring them in an effective way into the environmental sphere. With that, let me introduce our third and final speaker, Dr. Kate Rogers. Dr. Rogers is an executive manager in the Office of the Executive Director at UNICEF, working on a Promise Renewed initiative, which I think our first slide is up for that. Upon joining UNICEF, Dr. Rogers worked in the Division of Policy and Strategy, as well as the Division of Programs, focusing on the agency's engagement with civil society. Prior to joining UNICEF, she worked for the World Bank in Sierra Leone, where she led a research project that focused on the relationship between mining companies and host communities. Dr. Rogers, we're delighted to have you with us today, and we'll let you start your presentation.
Hi, thanks very much for the opportunity to join you this morning. The conversation or the presentation so far have been great. Committing to Child Survival, A Promise Renewed is a global movement to end preventable child deaths. Under the leadership of governments and in support of the UN Secretary General's Every Woman, Every Child strategy, A Promise Renewed brings together public, private, and civil society actors committed to advocacy and action for maternal, newborn, and child survival. A Promise Renewed emerged from the call to action, a high-level forum that was convened in June 2012 by the governments of Ethiopia, India, and the United States in collaboration with UNICEF. The more than 700 government, civil society, and private sector participants who gathered for the call to action reaffirmed their shared commitment to scale up progress on child survival, building on the success of the many partnerships, structures, and interventions that currently exist within and well beyond the field of health. Since June, 164 governments have signed a pledge renewing their commitment to maternal, newborn, and child survival. In addition, 185 civil society organizations, 220 faith-based organizations, and over 1,000 individuals have pledged their support to the global movement. Each signature represents a renewed commitment to work together across technical sectors and issue-specific interventions to advance one clear and compelling goal: ending preventable child deaths and sustaining the results well beyond 2015.
Dr. Rogers, I forgive this interruption, but we've been asked by the interpreter to have that for her purposes, it would be great if and we have the time, to speak a little bit more slowly.
Oh, sorry about that.
No worries. I know we put a lot of pressure on everybody to finish very quickly, but we're doing well on time. And so let me ask you to do that, and we'll start and go back to you. Thank you.
Terrific. Thanks. So why do we need to renew the promise to children? Over the past 20 years, governments have made countless commitments to tackle preventable child deaths. And we have seen tremendous progress in terms of the global declines in U5MR. But the progress remains uneven. National averages mask deep disparities within and among countries. Unless we start to systematically identify and address those disparities, the progress on U5MR will stall. For a long time, and still today, many development experts have argued that it's too costly to focus on the hardest to reach children. But recent analysis by UNICEF shows that the benefits of focusing on the poorest children, an equity approach, outweigh the additional costs of reaching them. For example, in low-income, high-mortality countries, every additional dollar invested in reaching the most vulnerable children can avert up to 60% more child deaths than the current approach. This is a highly significant finding, especially now in a time of global fiscal constraint. Under the banner of A Promise Renewed, we are intensifying our effort to reach the hardest to reach, the most isolated communities. This approach is applicable to all country contexts, rich and poor alike, because we know that even in the richest countries, there are those who are unable to access the services and supplies that are crucial for well-being. Evidence shows that if we apply the equity focus to child survival, we can achieve significant declines in under 5 mortality rates. A modeling exercise presented at the Call to Action in June demonstrated that all countries can lower child mortality rates to 20 or fewer deaths per 1,000 live births by 2035. Countries that have already achieved a mortality rate of 20 or below can sustain the progress by analyzing domestic disparities and intensifying efforts to reach the most disadvantaged groups. Achieving 20 by 2035 represents an important milestone towards the ultimate goal of ending preventable child deaths. The focus on 2035 certainly isn't meant to eclipse the focus on 2015, quite the opposite. 2015 is the immediate benchmark for progress. By focusing global attention on ending preventable child deaths, we hope that A Promise Renewed will spur progress towards MDGs 4 and 5 and will sustain global attention on the critical importance of child survival well after 2015. We need to continue to remind the world that while we have made tremendous progress on child survival, the agenda certainly isn't finished. As we think about the post-2015 agenda, we can't lose sight of the fact that the health and well-being of children is one of the most telling indicators of the health and well-being of society as a whole. We've identified 3 broad global strategies for accelerating declines in preventable child deaths. Under the banner of A Promise Renewed, governments are leading the effort to scale up action on 3 fronts. Number 1, sharpening and implementing high-impact plans with 5-year milestones. Number 2, building the movement to strengthen accountability. And number 3, communicating progress and mobilizing resources. For Strategy 1, participating governments are leading the effort to sharpen country action plans for maternal, newborn, and child survival. In most instances, the Ministry of Health assumes a lead role in strengthening national action plans. But the search for high-impact strategies goes well beyond the field of health and encompasses the full spectrum of public sectors and technical interventions that impact health outcomes for women and children, including the social determinants such as women's education and empowerment. This focus on the socioeconomic determinants of mortality is critical to sustainable results. If we incorporate within our conventional work on maternal, newborn, and child survival an emphasis on factors like women's empowerment, we won't just equip women and families with the skills and confidence to make healthy decisions on their own and on behalf of their children, but we invest in the economic sustainability of communities as a whole, generating benefits that span generations. UNICEF is working closely with USAID, Johns Hopkins, the University of Washington, and other statistical and modeling experts to ensure that countries have access to the latest data and modeling information for their national plans and strategies. Special teams of experts are being put together to meet the demand for technical analysis to support the planning at the national and, most importantly, at the subnational levels, with substantial effort in DRC Congo, India, Ethiopia, Nigeria, and other countries. To accelerate the reduction of their child deaths, India, Ethiopia, and Nigeria have already accessed the latest data and are sharpening their national plans. As noted by the Minister of Health for Nigeria, They used their data to turn their strategy on its head, focusing on what was killing their children, based on analysis of the nature and the distribution of mortality, not just at the national level, but also at the subnational levels. The second strategy of this three-part plan focuses on building the global movement to strengthen accountability. The promise to end preventable child deaths won't be fulfilled without strong public support for the principle that no woman or child should die from preventable causes. With the support of a large coalition of UN agencies, governments, civil society organizations, private sector groups, and other actors, the social mobilization strategy for A Promise Renewed aims to ignite advocacy and activism for child survival globally and nationally. Communities, local constituencies with an interest in maternal, newborn, and child survival need to take the lead in identifying local priorities for child survival and demand government accountability for national commitments to women and children. We're supporting this process by making available that local level data and analysis and making sure that communities have the tools in order to use that analysis in a way that suits them. Strategy 3 involves communicating progress and mobilizing resources for the goal of ending preventable child deaths. With the support of the MDG Alliance, the H4+, the UN Foundation, PMNCH, and many, many others, we're working to raise the global visibility of the goal of ending preventable child deaths by identifying, documenting, and disseminating the movement's successes and lessons learned. Each year, UNICEF and partners will review and report the world's progress on child survival. Data and analysis will be disseminated through an annual publication and through virtual platforms, including the website for A Promise Renewed. The resource mobilization component of this strategy emphasizes outreach to the private sector and other entities that support the research and development of innovative solutions for maternal, newborn, and child survival. Through this process, by working with the private sector, we're identifying, testing, and scaling up innovations that enable communities to track and report progress on maternal, newborn, and child survival. Thanks very much. That's an overview of what's involved in A Promise Renewed, and I'd be happy to take any questions on it in the discussion that follows.
Dr. Rogers, thank you very much for a wonderful overview of a real-world example of putting some of these principles into practice. I'm going to take, first of all, a moderator's prerogative and make a shameless plug for the Global Environmental Health Program at NIEHS, and just remind listeners that anybody interested can find out about our program and subscribe to our newsletter by going to our website, niehs.nih.gov/GEH, and find out more about some of the environmental principles that are underlying some of the discussion of today. We are going to transition into question and answer, and we invite everybody who is listening in, and we also have an audience in the room who is welcome to generate questions for our speakers. We have a good bit of time. We have fabulous speakers, and we've had very thought-provoking opening discussions. While we're waiting for questions to come in, I'll start with one question that of my own that has always challenge me as I think about these issues, which is whenever we see framework diagrams of the interactions between social equity, justice, environmental exposures, and health, they're always kind of complicated and somewhat circular. And we know that if we intervene on the social level, that we improve people's health and often reduce their environmental exposures. And if we reduce people's environmental exposures, we also improve their health, improve neurocognitive performance, and alleviate some of the factors that perpetuate poverty. And so my question for the speakers is, in terms of your experience, is there, and obviously this is not a dichotomy and it's not a one or the other, but in terms of effectiveness of interventions, what is the right balance? What is the right mix between investing primarily in environmental sectors or in the upstream sectors on the environmental side versus the idea that if we really focus in on education, poverty alleviation, social welfare payments, address really the root issues of poverty and education, that in itself will float all of the boats and address a lot of the environmental exposure issues through a whole range of mechanisms.
Shall I start?
Please, whoever would like to start. Dr. Marmot?
That's Michael Marmot. Well, firstly, I have two types of response. The first is that when we are looking at the level of income or level of development of a country, the answer to your question is clearly going to be, it depends. Where, if you're living in a slum in Nairobi, and if it costs you more to buy a litre of water than it would if you're living in London, the lack of availability of water, of clean water that people can afford, is clearly going to be key. And one can't focus simply on the other things as if they were simple and ignore the fact that people don't have water or shelter or food. So whereas in Central and Eastern Europe, for example, the data that I was showing, people do have clean water, they do have enough food, they do have shelter. There may be problems with the food they have, but they do have those things. So simply saying, well, we're going to focus on water or shelter for child development and child survival would be wrong in Central and Eastern Europe. So my first response is the mix will depend on the general background in low income, middle income, and high income countries. But my second, thinking about a high income country, and I would apply the same to a middle or low income country, when we think about the inequity in early child development or in child health in a country like Britain, we suggested that there are two approaches. One is reduce the level of social and economic inequality in society, because that clearly is key in driving the inequities in early child development and in child health. While we're working towards that goal, which could take a while, we need to break the link between people's social and economic position and the quality of child development and child health. And that might mean access to high quality services, supporting parents for early child development. It may indeed mean education of women, of mothers. And I think that we shouldn't say, so having started by saying, well, the mix will depend on whether you're in low, middle, or high income countries, but we shouldn't say, yes, in high income countries we need education and early child development. We need water and shelter in low income countries. In low income countries we need both. Education of women, empowerment of women, as was said by previous speakers, is, if anything, even more important in low-income countries. So we need to pay attention both to the material conditions in the environment and to the social and economic drivers of health and development.
May I intervene and have some comments on this circular approaches on social and environmental impact? I think we had a very interesting relation between the intervention of Michael Marmot and from Kate, looking if we focus on some of the processes we can improve. Nevertheless, I agree with Michael Marmot what he spoke about. If we take poor countries, and not only the poorest countries, but also the transition countries, there we have a much more complex approach to deal with. And I think we have on one side, if you go to the circular on the social impact. On one side we have education, on the other side we have public services, which are getting often destroyed due to the privatization processes now in the transition in poor countries. But it's also crucial not only to give social support, but to give the people the possibility to get incomes. Because if you learn or show the people how to fish, it's much better than give them the fishes. And there, for instance, we had a very interesting example in Mexico. In Mexico, the social program was giving a higher scholarship to the girls than to the boys. And this helped a lot in the rural areas to improve the education of girls, because family, due to this greater scholarship, sent the girls to the school, and then we had an enormous impact in terms of education, in terms of improvement of health condition, but also later in terms of reproductive health. And finally, the World Bank found out that it could educate girls and young women could improve 1% the GDP of a country. On the other side, the environmental issue is getting a so crucial process, because with more and stronger disasters, bad managed extreme events, obviously a lot of the possibility of the people in. You remember, I spoke about 5 billion people affected by disaster the last 30 years. This means that it's not 5 billion worldwide, but it's sometimes 10 times the same people affected. And this is one of the crucial issues to increase poverty. And this is a point. So we need simultaneously work on the social, educational, and health part, on the other side, on the environmental part, in order to overcome and to give this new generation potential to live better. And this is probably a very different approach in Europe, where I have seen this, than in the countries in the south or in the transition countries. And finally, one point. A lot of social programs, specifically in the south, are threatened by corruption. Not only public corruption, but also corruption of NGOs and of social movements. And if we don't have a system of control in order to avoid this, in order that this support will be used for political or voting preferences, I think we will lose a lot of them. And this means a point we have not talked about. We need much more involvement of the society in order to control this social supports, in order that they really go to the most vulnerable and the most necessitated people. This would be some of the points also from the southern part.
Thank you very much. We have a question from the room. Dr. Goldstein?
Thank you. This is Dr. Bernard Goldstein, University of Pittsburgh, and a member of the Planning Committee of the IOM Roundtable. We've just heard 3 really stimulating calls for action. I think the action that all have called for, it has to do, at least in large part, for government investment in areas, although we heard just the very last comment was one which talked about civil society. Dr. Marmot, through the years, has, I think, provided us with the best, if you will, hard data as to the role of social inequality in providing a basis for this. So, Dr. Marmot, I'd like to question, though, and to basically repeat to you a criticism of your EU data, which I just heard yesterday. I hadn't really seen the data till you presented it. And it really goes to the broader issue of the civil society and government roles. The criticism is that that what you're looking at within the EU is primarily an effect of the older Eastern European countries that still haven't quite caught up, and there's some special things happen there. And I couldn't help notice that when you looked at the slide between the relationship between social welfare spending and all-cause mortality, that from an eyeball point of view, if you took out the Eastern European countries, you still had a very wide range in social welfare spending among the EU countries, but very little difference in mortality. Let me also then add to that the question of whether by social welfare spending you're capturing not only government spending, but spending by civil society, by charitable groups, by church groups, by others who are involved in alleviating poverty and dealing with gender equality and other issues that are so important.
Thank you. It's very clear that civil society is important, and by emphasizing the role of government, I'm not in any way trying to underplay the importance of civil society. Just firstly, those figures in the graph that I showed you are government expenditure on social welfare spending, and if you took out the countries, the newer members of the European Union, the relation is not as steep. But we're still talking about Ireland and Portugal with an age-standardized all-cause mortality of 750 to 800, and Sweden 600. So yes, it looks curvilinear and it's exaggerated by the Czech Republic, Poland, Slovakia, and Hungary. But we're still within the older members of the European Union. There are substantial differences in mortality. That difference, it would be a third higher. Sweden's mortality, if this were causal, would be a third higher if it had Irish levels of social welfare spending compared to its own. So it is very substantial. One shouldn't trivialize it. But we then need to ask, what is it spent on? Now, some of it, as I showed you in looking at child poverty, government can reduce child poverty by taxes and transfers. But the quality of early child development isn't only influenced by government expenditure. And here, it's been put to me by different countries in Europe. The Minister of Health from Malta, for example, said, we don't send our children to early child development. We look after them at home. Are you telling us that that's what we've got to do? Well, I'm not telling anybody what they have to do. What I can tell you is what the evidence shows is that for children, particularly from deprived families, attendance at early child development at formal early child development centres makes a difference to early child development. It makes much less difference to children from well-off families. So the evidence is in support of it, but it doesn't have to be provided by government. It may well be provided by civil society, and it may be provided by families, which the well-off families seem well able to do. So the point's well taken. I wouldn't take it as a critique. I'd take it as a constructive point that government welfare spending matters even within the older EU countries, but much more than government spending is important, and civil society has a key role to play.
Thank you, Dr. Marmot. Did other speakers wish to address that question? Okay. I'm going to take a question now from Dr. Judy Wasserheit, who is also on our planning committee and my co-chair on the Innovation Collaborative on Global Environmental Health and Sustainable Development. And her question is also related to this theme, and then we'll have some questions that move us to some other themes. She's asking specifically, what do we know about the impact of these social transfer programs, such as conditional cash transfers or broader programs such as Oportunidades in Mexico? So it's the impact of social transfer programs on environmental sustainability outcomes. We've talked about social transfer impacts on health, social impacts on social transfers on childhood development and employment. But do we know anything about the impact of these transfer programs on environmental outcomes specifically? And do we have any studies that have included environmental outcomes as well as health and education outcomes? And I'll open that to anybody who can address it.
Yeah, I think I will start with the oportunidades in Mexico. We have in this program only a poverty alleviation program, so we don't not link it up to environmental outcomes. And I think one of the proposals precisely which was coming out from the university was to not only give people, because if you look at the global poverty process, you can see clearly that we couldn't reduce poverty in Mexico. On the contrary, poverty has increased by the data of CEPAL. So we must, and this would be a very crucial issue, link up social programs together with environmental processes. For instance, small businesses. If you remember the first photo I showed you about the garbage management, waste management, there we have a lot of potential to recycle, to reduce, to use these garbage processes for small micro businesses. And still, at least in Latin America, more than 80% of all the jobs are created by small enterprises. So I think if we would focus on one side, the money not transferred to the people, but transferred to small programs linked up with our environment, we could give a very big jump in order to do both, improve social conditions, reduce poverty, and improve environmental services.
Thank you very much. Other speakers?
Somebody else may know more about Bolsa Familia in Brazil than I do, but if it's true, as my Brazilian colleagues tell me, that Bolsa Familia by itself has had an impact, has been an important contributor to the drop in the Gini coefficient in Brazil. And as you know, the Gini coefficient measures income inequality. The Bolsa Familia by itself has had a role in reducing poverty and reducing the level of income inequality. One can imagine it will have improved environmental conditions for poor people in Brazil. Whether it's had an impact on environmental sustainability, I don't know.
Thank you very much. I'm going to take one question from our web audience. A question from that's asking, what are the primary research gaps in the area of One Health? We talked about One Health as one of the frameworks bringing together animal health, livestock health, zoonotic diseases, and human health. And so this question is, what are the primary research capacity gaps? And also, this person's asking more broadly, outside of One Health, what would be the very top research priority in this area? And again, I'll open that to anybody who would like to address it. Well, hearing no immediate ideas, I'll let our speakers maybe ruminate on that for a little while, and we have many questions coming in. We have a question in the room that we'll entertain, and then we'll go back to the web.
Well, this is Ana Boisco from Washington. I'm glad to see different macro-level frameworks together. For example, the Millennium Ecosystem Assessment with the Millennium Development Goals. I think that's the kind of homework we need to do at the ground level also. And talking about environmental outcomes, I would like to offer the idea that was developed extensively by Lynn Ostrom, one economist, about the governing of the commons, because in this kind of a very ground level framework, we have the opportunity to put people together, especially with the government programs, to make certain decisions and manage environment. And I didn't see too much, perhaps I didn't see too much of these studies anyhow, but in general, including health. So for me, is the homework, the groundwork we need to do to merge available frameworks at the ground level to see where to invest our scarce resources, relatively speaking, for the level of poverty and the environmental degradation. So I think this is the kind of homework we should be doing at different levels.
So I'm sorry, is there a question in there? I heard a comment, but what is the question for the speakers?
No, it's more of a reflection on trying to merge these macro level frameworks at the ground level, and I am introducing this person that has done worked extensively with, governing the commons.
Very good, thank you.
And if you want to, I can just make a further introduction of Lynn Ostrom. She was, let's say, the first woman to have an economic Nobel Prize, I think in 2006, exactly about this kind of framework of, putting people sitting together to make decisions and manage the environment for sustainable development.
Thank you. I'm actually going to follow that up by combining two additional questions we have that I think address this as well. And there will be a question at the end of it, so hang on. So we have one question, which is that the concepts of equity and justice require two levels of approach. The more operational, through concrete actions that attend specific indicators, and the other one being a more philosophical approach related to a more humanistic concept of policy. So in summary, these two elements demand a change in the traditional concept of politics, and the question from this person was, how are governments addressing this change in, I guess, business as usual to incorporate both the specific but also the philosophical change? And I'm going to tack onto that a question that we have from Dr. Galvao, which is to put all of this into the context of the current UN process of the post-2015 MDGs and the Sustainable Development Goals, and ask the speakers, how can this process that's going on at this very macro level address these two kinds of this, I'm not going to call it a duality, but these two thematic issues. On the one hand, we have this process which operates at a global level and certainly can influence the tenor and the philosophical approach, but it's also an opportunity to identify specific indicators that will drive on-the-ground operational approaches. So if we could get comments from the speakers about how they see the paralleling and some ever-changing, let's say, UN process as an opportunity to address this within this context of on-the-ground versus philosophical, more macro-level systematic changes. And that's a long and rambling question. I hope that I anticipate the speakers are ready to just jump in.
Well, I'll jump in. I think the first question about the practical and philosophical levels of equity and justice is a very important one. And I can see what's been happening in my own country, for example, in Britain, that the idea of fairness has taken off. And you can say, that's great. People are talking about fairness. The problem is, firstly, I'm told that across Europe, fairness is not, doesn't have the same currency. Other European countries think when the British talk about fairness, they're talking about cricket, and that doesn't go down very well elsewhere. But the problem with talking about fairness is it's become a slogan that's empty. It's become completely empty. Fairness is whatever the government decides to do. And then they say, we're doing this because it's fair. So I've been arguing against that. When they reduce the highest level of tax rate, they say it's a fair settlement. When they reduce tax credits for poor people, they say it's fair. When they reduce the benefit levels for people who are poor, they say it's fair. And I think we shouldn't use language as if it has no meaning. Now, I come into it in admittedly a slightly tautological way, but it gets to the question about being practical as well as philosophical. And I say, I'm a doctor, and I'm concerned about health. That the systematic inequalities in health between social groups that are judged to be avoidable by reasonable means and are not avoided are unfair, hence inequitable. Therefore, any policies that lead to these avoidable health inequities are unfair. So we've got a way of actually judging the fairness, the justice of policies by the impact on the lives people are able to lead, and hence on likely health inequalities. And one of the problems, and it relates to the earlier comment, is what we see in many European countries, and I think it's going on elsewhere, is governments are saying, well, we used to be concerned about green issues. We did have goals about reduction in carbon, but given our economic problems, we can't afford to be green anymore. We're going to drop the green goals and just go for economic growth. And this, of course, is appalling, short-sighted, totally unjustified by the evidence. The idea that if you make the environment worse, you'll get better economic growth, I think is questionable at best and likely to be contradicted by the evidence at worst. But it is appalling, an example of saying, well, we're going to choose between being green and going for economic growth, and we'll take growth rather than green. And I think this is a very bad way forward. I mean, I've been jealous of the fact that environmental issues have apparently been on the agenda. Rio +20, very important. But one of the things that came out of Rio +20 is we can't pursue environmental goals without pursuing poverty reduction. And I would say we can't pursue economic fortunes without pursuing both fairness, justice, and environmental goals at the same time. And just commenting briefly on Dr. Galval's point, hello, Bhutto, I would say that the issue of getting the indicators right, getting the measurements right, is potentially very powerful. Because if governments and UN processes are going to take this seriously, then getting the right set of indicators, both on health equity and on sustainable development, are potentially very powerful in influencing policy.
May I give just a very short comment? I think if you look at the global indicator, we can see that the Gini indicators, that means social inequity, is growing for the moment. If you look at the data I gave before about environmental destruction, we have almost in all issues worse situation. So on the other side, we are suffering on global environmental change, on global warming, and that's creating an enormous uncertainty for the future. So on the philosophical part, business as usual is not the way to deal with our future. So we need really to change this business as usual into a transition process. And for this reason, probably it may be more convenient to speak about a transition to sustainability instead of speaking about sustainable development. Why? The last 20 years, and we had just Rio Plus 20 this year, finally we couldn't revert the destructive development process which was going on Earth. It's now worse. For instance, if you look in Latin America, more than half of the soil is now in hand of a very few group of mining companies which are not only destroying air but also water and taking it away from a lot of productive process. So I think in order to achieve more equity, we need to change our mindset. We need to change this business as usual. And there I was very happy about the comment on the comments. I think we have to go back to the Nobel Prize Ostrom and to really work much more at not only at macro level, but at macro level we need this new mindset, but at micro level we need concrete policies in order to link up environmental business with social and poverty alleviation, social equity. And if we could do this together, and this oblige us to change the political approach, to go through a participative governance in order really to confront the new uncertainty we are living, to find a green process where first we restore and then second we recover this process of doing. And this obviously on one side is obligation to be very, very careful about the indicators we use and linking up these socio-environmental indicators in order to just stop the process of destruction and be very clearly what kind of productive process is now destroying wide resources we will have on Earth, and thus bringing us to very high new threats on health.
Hi, this is Kate. I'm going to take the question from a completely different point of view. I like the way that you formulated the second half of the first part of the question in terms of the change that's required on the traditional concept of politics. It's a conversation that we've been having in UNICEF with quite a few of our partners when we talk about enhanced accountability for equitable outcomes on child survival as well as any of the other areas in which we've worked. You know, there seems to be a growing consensus that you can't necessarily put the onus on governments alone. What's important, I think, what's going to have to change increasingly over the next few years, especially when we talk about the post-2015 agenda and other global processes, is you really, the responsibility for holding governments accountable really does need to rest increasingly with the civil society networks, with the community-based constituencies that are involved in and advocating for increased government responsiveness when it comes to those equitable outcomes. And the best way to do that, we found, is just by making sure that those community groups, the civil society groups, have the data and analysis that they need.
Thank you very much. Three excellent answers to that. I just wanted to comment that these webinars are sponsored by the Innovation Collaborative on Global Environmental Health and Sustainable Development of the IOM Roundtable. We just had an excellent meeting yesterday discussing directions and activities for that Innovation Collaborative, and two of the themes that came up yesterday are being repeated here today. One is the need for really good indicators, that indicators will drive this process, that indicators will either help us integrate social and environmental goals, help us integrate environment into health goals, or they will prevent that integration. And so I'd call on the entire community to engage on this issue of what are the best indicators, and certainly our experts on the call to help us with this. And the other is economic valuation and economic systems, and you know, how do we work with the field of economics to ensure that the values that we're talking about today, values of equity, values of sustainability, long-term planning, are adequately accounted for in the systems and the paradigms and measurements that economists use, which really end up driving many of the venues that we're talking about. So two themes that certainly will merit ongoing discussion throughout this webinar series as it evolves, and also outside of this webinar series. We have a couple of other questions from the web. One of them, and I'm going to, well, I'll read the question and I'll put a little extra spin on it, which is, the question is, your ideas on how to address inequalities in sustainable development and immigrant populations between countries. And I'm going to broaden that a little bit and evoke the uncertainty about habitability that is being brought on us, especially in the most vulnerable parts of the world, by climate change, and the issue of environmental refugees, whether from drought and climate reasons or from other environmental reasons. How do, I guess the question here is, how do we address the issues of refugeeism in general, but specifically in the pending concern we have about climate refugeeism in some of these parts of the world in this context of achieving sustainable development and social equality? And I'm done rambling, so I'll turn it over to the speakers.
Thank you. I think we should care about the term of refugees, using it for environment, because all the studies we have done the last 5 years shows that migrants, environmental migrants or environmentally induced migrants or forced migrants due to environmental problems are normally very complex migrant patterns. So you have basically, if it's not a big disaster where people had to live because it's impossible, or a development process where, for instance, a dam where people can't no more live, if it's because of soil loss, fertility loss, or it's of water scarcity, it's drought, it's famine, then we would prefer to use the term migrants. In order, the refugee terms is basically used for the Geneva Convention, and there it's complicated to put the environmental induced migrants into this category, because they are normally not political refugees. So what is crucial there is, if they have to migrate, to find, to organize, and as we have seen, most of the migration is still inside the countries, and normally we have an urbanization process going on. So it's on one side the local administration of the towns, which should have some type of lands in order to have a reserve to give these people life quality, services of water, sewage, drainage, and some also potential to live there with dignity. And on the other side, in the international migration process, you have all these often illegal migrants. Mexico is a country where we have trans-migration from Central America to the United States, and we have also migration on this border. And both border lines are very conflictive regions. So there the government must train the people in charge of the migrants, must give them the potential that these people have a dignified livelihood and that they are not threatened with their own life. We can speak that we have, for the moment, we are speaking about 20,000 people who are missed, and this is one of these outcomes if the political level is not congruent with the human right level, and there we have probably really increase this process. And there, human security as a concept of freedom of fear, freedom of want, freedom from disasters. And freedom to live with dignity would give us a chance to at the global level to access to these environmental migrants.
Thank you, Doctor. Other speakers with a comment on this issue of environmental refugeeism and other population migration?
Well, just picking up the theme that much of the migration that we're talking about is urban-rural, rural-urban. It's not just international, although it's a big issue. And Nick Stern, who former chief economist of the World Bank, now climate change expert, but when he pointed out that, taking Kenya as an example, that at a time when Kenya's population grew about threefold, agricultural productivity did not grow. The result, of course, ineluctably, predictably, huge rural-urban migration. So rather than simply, and then these large squatter settlements that one sees in the big cities, you know, a Kibera with 600,000 people in it. So that demands two responses. One is putting real effort into improving the situation in rural areas. And it's been put to me, and I'm not an expert in this, that in terms of agricultural productivity, it's been said, there's no doubt that Africa could feed itself. The technology is potentially available, the environment's potentially available, but it needs bringing of these things together. So the two responses, one is putting more effort into improving agricultural productivity, improving rural conditions. But second, once people are in the cities, paying real attention to the conditions in which they live and work, which is the social determinants of health. And that's not been a high priority in most cities of low and middle income countries. And of course it needs to be, and it's a big example of what we're talking about, of bringing environmental sustainability and health equity together.
Thank you very much, Dr. Marmot. And with that, we will draw this to a close. If everybody who was listening was able to turn on microphones, I'm sure we would have a resounding round of applause for these speakers. This has been a wonderful webinar. I'd like to thank you all very much. It has been a wonderful discussion of the linkages between sustainable development, equity, and social justice. And as indicated, this is the final of the 3 webinars of the calendar year 2012, but we will be continuing with webinars every other month moving into next year. We are planning those topics now, and so please stay tuned. We will be continuing this discussion, as I indicated, on some of the themes I think that we have raised today and in the previous 2 webinars. And I just want to remind everybody that the Institute of Medicine will be releasing a written summary of all 3 webinars, which I hope will serve as a valuable resource to those who have participated in these events and those who haven't had a chance to actually listen in, so that we can share the wealth of the discussions we've had. With that, I thank the speakers again for 3 fabulous presentations and answers to challenging questions. Thank all of you for participating, and we'll adjourn the webinar.